What's up, beautiful people? Another day, another study. In 2019, stroke was the second largest contributor to mortality globally, an estimated cost of $2.3 trillion. In the US, it's estimated that one person dies of a stroke every 3 minutes and 30 seconds. As a primary care physician, both in the clinic and then as a hospitalist in the hospital, I've treated stroke patients from the moment they arrive to the hospital to while they're at the floor of the hospital to discharge, and then again in the clinic. And I've seen how devastating and debilitating stroke can be for an individual and for their families. Well, this study was looking at the association and doing an MR study to look at possible causal relationship between fiber intake and stroke in US adults. The mean period of follow-up was about 7 years, and the average age of participants was 47 years old. And compared to the lowest fiber tertile, which was about 11 grams of fiber per day, the second tertile, which was 10.9 to 18.3 grams per fiber per day, and the highest tertile, which was above 18.3 grams of fiber per day, had a lower risk of stroke. So it was 19% for the second tertile, 29% reduced incidence of stroke for the third tertile in the fully adjusted model. And the MR analysis did show a causal relationship. Now, in this MR model, they were looking for genes that predict a higher fiber intake. And it's pretty interesting that certain genetics are associated with food preferences and food choices, and certain genes are associated with a higher fiber intake. And so those who had a genetically predicted higher fiber intake had a 17% reduced risk of stroke. And potential mechanisms for this include reduction in inflammation, reducing lipid levels, improving insulin sensitivity, and thus reducing blood pressure, which is a big risk factor for stroke, and also benefits to the intestinal microbiome and maybe some of the metabolic markers that the microbiome makes, like short-chain fatty acids, which have been associated with beneficial health outcomes. Now, there were some significant limitations. This was not a randomized controlled trial. It was self-reported stroke, so they did not go back and actually look for hospital records or anything like that to actually make sure these people had a stroke. They did 24-hour food recalls, which can have some bias associated with them, and the genetic analysis was based on European data. So you have to take that MR study they did with a grain of salt. But overall, this adds to the body of literature suggesting that one of the best interventions that we can do for our health is actually increase our fiber intake, meet the recommended minimum of 14 grams per 1,000 calories. I tend to aim for 40 to 50 grams of fiber per day.